Hey, good morning, everyone.
We see people still filing in, so we'll wait another minute or two
Yeah,
so people can catch the beginning.
yes. I'll let everyone join.
And we got Amy on the controls over here, so any
I
technical
am.
difficulties, we can blame her.
Hey. All right, let's see.
We are
Good.
screen
They
sharing.
can hear. Everyone can hear. Yay. Awesome. Good morning, Vicky. I have to be able to see these other. We got those. Okay, so we can see that one too. We still got people joining, which is a good thing. We want you guys to join. We will be doing this for 3 weeks. This is going to be part one today, of course.
Looks good enough to me.
Think so. You ready to go?
All right.
All right. All right. So this is the part one of the endurance training. My name is Amy Bostick, and I am the Director of Agent Service.
And I'm Robert Sterling, and I'm actually Director of Career Agency here at Eldercare, one of three distribution channels we have here at Eldercare. I primarily work with our captive agents, but also deal with a lot of you folks. I haven't seen any familiar names on there. Maybe you guys are newer, but I do a lot of help in the sales processes with a lot of our broker agents and agents across the country in all areas of our distribution channel. So again, Robert Sterling, and I've got 15 years in the business, all here with Eldercare, and have been in a leadership position with integrity since 2016. So fairly knowledgeable in what we're about to go over. Um, just to give you a little, Amy's not going to tell on herself, but those of you that are on here, if you've ever called me asking for anything, I usually get text or messages from somebody else. Oh, Robert was so helpful. Robert's the man. Little do you know, half the time I'm asking Amy questions before I get back with you. But so we're kind of a team in that regard. I
Yeah,
mean,
absolutely.
every now and then she may ask me a question or two, but one way or the other, we're going to figure it out. And there's a good chance that all your questions can be answered, whether it be compliance, product knowledge. Again, I deal more on the sales side, so I do a lot of training on the how-tos in presentations and follow-ups and whatever else you may need in the sales process. So we really appreciate you guys being on this call today, and hopefully you get some valuable information that you can move forward in your career with Medicare insurance.
Yes.
So
Yeah.
we'd like to encourage um,
Oh,
questions in the chat.
yes.
I think we're going to do a poll here in a minute
Yes.
just to see where everybody stands, what level of knowledge you have in this area, so that we can kind of cater this call to the most likely recipients. Okay, so if it's newer or more experienced, new to Medicare, longtime insurance agent, but new to the health field, new to the Medicare side of
Right.
things,
Yeah.
we'll cater it towards that.
Yeah, absolutely. It'll give us an idea of which parts of this we need to elaborate more on going through these slides here. So to get us started, though, we are, like you said, going to do a poll, and I'm going to go ahead and start the poll. So you guys, if you guys will answer the poll, that way we can kind of get an idea going, and we're going to launch this. All right. Hopefully you guys can see the poll up there now. So on this poll, it's just asking how long you've been in the insurance industry, what product line that you focus on most. And I will kind of give you guys the answers that we have majority here. Wow, it looks like a lot of people have been in the industry for a while, 5+ years.
I like it.
Yeah. Looks like
Medicare
majority,
Advantage.
yeah, looks like majority of you are Medicare Advantage focused. Yeah.
Those are the only two questions.
Yeah, looks
All
like
right.
it. Yeah. Think we got everyone's answered there. All right. So it does look like majority of you have been in the industry for over 5 years. We do have about 26% of them either 1 to 3. So, and then it looks like majority of you focus mostly Medicare Advantage, and Medicare Supplement is our top ones on that. All right. Here we go.
Thank you guys for doing that.
Yeah, thank you so much. All right. So, part one. So we're going to be going over the basics of Medicare. So, it's going to go over parts A, B, C, D, and the enrollment periods, which you guys, most of you probably know we're in open enrollment right now. So we will go over those other enrollment periods as well, and give you some tools to help simplify the Medicare conversations that you may be having with your clients or potential clients. And let's see, here we go.
All right, we'll begin with what is Medicare. Again, based on the poll you guys did, a lot of you guys will know this. So, take what you can from this, leave the rest. If there is a useful piece of information that can advance your sales skills or your presentation skills, fantastic. For those of you that are new here, this is simply in number one, in my personal experience in the field, and then also in my experience with dealing with several different hundreds, if not thousands of agents across the country. And what's unique and beneficial about my position is I do get to experience or get shared experiences from agents from all walks of life in all areas of the country. So, we're able to formulate what works best in a large scale situation. You may have this script that works for you, so and so may have this script. We've been able to condense everything and find one that's going to work a larger percentage of the time than maybe what you've been doing. I know there's that saying, you can't teach an old dog new tricks, but I think Ray Kroc, the founder of McDonald's, had a saying, when you're green, you're growing. When you're ripe, you begin to rot. So I don't think there's, in my personal life, I've always had that approach. In my professional life, I've always had that approach, as I'm always teachable. I'm always
Yeah.
open to new suggestions. And a lot of the suggestions I've been given, immediately kind of made me cringe, like that's not going to work, whatever. But I've always been willing to give them a try,
Yeah.
and a lot of times after I give them a try and they seem to work, I'm able to implement them into my procedures and my presentations. And again, it's not just from my personal experience. I'm able to share the experience of thousands of agents across the country. So what is Medicare? Okay. The definition: Medicare is a national social insurance program providing health insurance to individuals age 65 plus and certain younger individuals with disabilities. Obviously, Medicare disability would be available to those under the age of 65. The governing bodies include CMS, which is the Centers for Medicare and Medicaid Services. And what they do is regulate Medicare Part C and D plans. And then the Social Security Administration handle the Medicare enrollment and the Part B premium. Okay. Again,
Yes.
simply put, for folks 65 plus or disabled or have end stage renal disease. Okay.
Yes. Yes.
So, in saying that, let me convert that over to uh, where it might be beneficial in a sales scenario, because I think that's why we're all on here. We're all Medicare agents. We absolutely love helping people. We also are fortunate enough to get paid a decent living for our time in helping these people. So in a sales scenario, in the explanation of Medicare, especially if it's a new prospect, okay, new to you, when you're explaining Medicare, something you want to keep in mind is simplifying things for
Yes,
them. Okay.
absolutely.
Medicare is obviously confusing. Anybody that's gone through AHIP, there's a good chance it's a challenge for
I
you
mean, I can't
every
imagine
year.
turning 65 and not being in this industry. I mean, they're so overwhelmed and
Absolutely.
so confused, and they have people coming at them from all different directions. So simplifying it and just being there to explain it is very, very important.
Well, as we are, as
Mhm,
agents who do this year after year after year
mhm,
with some of the new changes, some of the new policies, some of the new procedures, the new plans, the discontinuing plans,
mhm.
it's also confusing for the professionals. So in a sales scenario, I always like to say, don't leave them with more questions than
Right.
answers at the end of your presentation. When you're getting towards the end of securing an application, the worst thing you can hear is, wow, you've given me so much information. You've given me a lot to think about. Okay. That will generally come when we're overloading these people with information.
Right.
Okay, so when we can simplify it while staying compliant, it makes the decision process a lot easier at the end. And everybody in sales knows that more important than the product you're selling, more important than the value of the product you're selling, is the trust they have in you.
Yes.
Okay, if
Very
they
important.
trust you, um, chances are they're going to enroll with you. Chances are they're going to stay with you for the remainder of the time
And refer
that they're
you.
on Medicare. Yes, and refer their friends. Oh,
Yes.
you've got to talk to
Yeah.
Robert. He made this so easy for me.
Right.
So simplifying the process, leaving them with less questions than answers at the end of your presentation should be key,
Absolutely.
even when we're explaining what Medicare is to
Hmm.
beneficiaries. Okay,
Yes. Yeah,
and
absolutely.
forgive me. Every webinar I do, I generally have to at the end of it say, "Hey, we didn't finish everything. Let's join another webinar next week." So try not to be long-winded, and we'll move on to the next one.
All right. Now, I do want to point out once someone's been on disability for 24 months, that's when they do qualify to receive Medicare early. I've had that question come up a lot here lately. So I just want to mention that. And we're going to go on to the next one here.
All right.
All
Super
right.
easy data analysis. Over 65 million Americans depend on Medicare to cover their health expenses. Um,
That's a lot.
98% of those 65 million Americans have a product to go along with their Medicare that you
Yeah,
either offer or should be able to offer, which is Medicare Advantage plan or a Medicare supplement plan.
absolutely. Absolutely. And here we are going to go over the enrollment periods. So each one of the products, Medicare itself, as well as the Advantage and the supplement, all have different enrollment periods that they have. So, whenever they first get onto Medicare, you have your initial enrollment period, the IEP. Now it is 7 months, and it is 3 months before they turn 65, as well as 3 months after they turn 65. And it does include the month that they turn 65. Um, so now with that being said, someone who is getting on Medicare prior to turning 65, that would also go around that their part uh initial enrollment period would be whenever they receive their Medicare. Now the general enrollment period, typically if someone maybe delayed their Part B for some reason, and they don't have a qualifying event to enroll, there's a general enrollment period for that, and that is January 1st to March 31st, during the same time of the open enrollment for the Medicare Advantage. The special enrollment period, I'm sure a lot of you are familiar with those. There are, qualifying life events where they can enroll into Medicare Parts A or B, outside of the general enrollment or their initial enrollment. Um, the Medicare Advantage. So we have the initial enrollment period, and it's the same, the 7 months, 3 months before, 3 months after, and the month of. Now, annual enrollment period, which we just got out of, love it. That's when a lot of you make majority of your money if you do this product. Um, so it's October 15th to December the 7th. So we are in open enrollment, which is directly following annual enrollment. The open enrollment is a lot of times people don't really know exactly what you can and can't do during this time. So I do want to mention, during open enrollment, it is a one-time change for someone who has a Medicare Advantage. So I just want to point that out, and it will run until March 31st. And of course, you have your special enrollment periods for the Medicare Advantage. I don't know about you, but we've been getting a lot of the disasters being declared as a special enrollment. Here lately, we've been getting a lot of questions on that. Have you guys been getting?
We have.
Yeah.
Surprised we don't have one popping up right now.
Right. Yeah.
But from the guidance I've received via CMS and the carriers,
Mhm.
if this will help clear anything up, disaster SEPs
Mhm.
effective April 1 will only be able to be apps submitted by a client calling Medicare.gov, and I guess CMS will verify that they
Right.
have an
Yes.
election due to disaster,
Mhm.
and they will enroll it. So it essentially is taking the agent out. Carriers so far have gotten to me. They're not sure how AOR is going to work in those
Yeah,
situations. So I haven't
got that
received
question.
concrete information on that yet. More details to come on that. But essentially, and in my opinion, and like in the talks that I have with carriers, Medicare members generally don't know about
No.
disaster SEPs unless an agent brings it up to
Yeah.
them. So I doubt you'll see a lot of, if your concern is that you have a client and you're going to lose them to a disaster SEP enrollment that they're going to have to do on their own. Number one, we don't know how AOR is going to work yet with the various carriers we've spoken with. And number two, there's a good chance they will not know about a disaster SEP because typically it's the agents that's letting
Right.
them know about a disaster SEP.
Yeah, that's very true. And yeah, we have gotten the question about when that rule goes into effect, how that AOR is going to be affected. I do believe though that it's just them having to get, I guess, approval and verification that they can enroll with that SEP. So I think that the agents are still going to be able to assist in that. But like he said, more details to come on that. So on the Medicare supplement, are these slides available? Yes, Sylvia, these slides will be available. Uh, Now the Medicare supplement open enrollment period, it's 6 months. Now, it can be based off of the Part B effective date if they delayed enrolling past 65. Otherwise, it would be based off of them turning 65. They have the 6 months if they take it out when they first turn 65.
Yeah, almost two Medigap open enrollments, either when you turn 65
Mm-hmm.
or when you begin your Part B.
Right.
The second scenario would come that someone turned 65, received Part A, kept group insurance,
Right.
retired, getting Part B. Now they are, and I've gotten this question a lot lately, is that considered open enrollment or
Yes.
guaranteed issue? It's absolutely open enrollment to enroll in a Medigap plan
Yes.
as they're receiving their Part B.
And I try to stress the fact that if you can use open enrollment instead of a guaranteed issue right, you want to anytime.
Absolutely.
Because one, the most important thing is it gives them more choices on what plan that they can take out, where guaranteed issue does restrict that on their
And a little
plans.
side note on that, although the open enrollment period is 6 months prior,
Yeah.
a lot of the carriers have it, man, there used to be the majority of the carriers used to allow you to write a Medicare supplement application 6 months
6 months
prior to the
before.
effective date.
Yeah.
But more and more, the majority of them are actually moving to that 3 month
3 months.
window.
Yes.
So always keep in mind what carrier you're writing if you're trying to enroll somebody into a Medicare supplement at the 6 month mark.
Yeah, I have noticed that too, that a lot of the carriers are coming out saying not 6 months, it's 3 months prior now. A lot of them are moving to that. Now, on the Medicare supplement, I have got this question a lot lately too about when you can and can't get a Medicare supplement. You can change the Medicare supplement any time of the year as long as they can pass underwriting. So they don't have a restriction on when you can and can't get into the Medicare supplements like they do on the Medicare Advantage and the drug plans. So I did want to mention that as well. Now we have the enrollment periods.
Oh,
I'll let you take this one.
okay. Thought this would be hers. I wasn't prepared for this one. Okay, so IEP, initial enrollment period, 7 months starting.
Yeah.
Can you go back one?
Yeah. Let me move this stuff out of the way here.
So the dark blue represents original Medicare. Okay, that's what I thought. All right.
All right.
Dark blue, dark yellow, light yellow. Dark blue, IEP, initial enrollment period, 7 months, starting 3 months before you turn 65 and ending 3 months after the month you turn 65. Again, that is the time that somebody could enroll in Medicare itself,
Right.
okay? Turning 65, working, not working, whatever. Now, I'm going to tell you, as people that are turning 65, given that they qualify, met all the criteria to receive Part A and Part B, Part A will come automatically on their birth month that they turn 65. And if they are drawing Social Security at 65, Part B will also be automatic. Okay, so when I say that, and there's a big difference in, hopefully a lot of you are targeting T65 in your marketing efforts. For various different reasons. Obviously, you don't have to pass underwriting
Right.
if you wanted to go Medicare supplement. And again, I think a lot of people, the allure to this industry is the renewal pay. Okay, so just statistically speaking, if you write a 65-year-old, that's going to be your longest renewal
Yeah.
of anybody. You know,
Absolutely.
obviously 65, you write a 65-year-old, a 75-year-old, statistically, you should get 10 more years out of a 65-year-old. So it's a fantastic market, you know, not to mention 10,000 people per month, well over 10,000 now per month are turning 65.
65, yeah.
Okay, so some advantages of that are, number one, they don't have to pass underwriting if you're choosing to go Medicare supplement.
Right.
The reason I'm trying to tie that into what I said about automatically getting Part A and receiving Part B automatically if they're on Social Security is, I think there's a common misconception that people need to have their Medicare number in order for you to write a Medicare supplement.
Yes,
So
right.
if you have a carrier that will allow you to write it 6 months out, you are able to go ahead and write them if they're turning 65, you know they've established enough credits to receive Part A, you know they're drawing Social Security, you can count on them having their Part A and Part B and use those dates, their birth month dates when you're filling out the
Yes. Yeah.
application. And different carriers, some will allow you to leave the Medicare number blank. Some of them make you put unknown. Great question for Amy. Hey, I have somebody turning 65 in July. What carrier can I
Yeah.
go ahead and write them with? And the advantage of this is phenomenal, that if you're writing somebody this far out, okay, because you're going to secure them, and especially on a Medicare supplement, you're able to receive payment. Okay, so one of the questions on a Medicare supplement app is draft on effective date or draft on issue date.
Right.
Once you draft on issue date, which will be just a few days after you submit that application, now, you know, if you've dealt with anybody turning 65, they're getting an abundance of mail, an abundance of calls. From that point forward, when they are receiving these calls, if they've already enrolled with you, given you personal information, Social Security number, banking information, and they've received a draft, there's 10 times less likely to give any more information to another agent. Nope, I've already done that. In fact, they've already taken my July payment out.
Yeah.
Okay, now,
Good point.
have I changed people that have already done that? Absolutely. But it's very, very challenging, and the likelihood of you maintaining that policy and them starting it with you increases tenfold if you're able to do that. So I would always encourage, if you're going if you're targeting the T65 market, obviously I'm making sure, number one, that I have a couple of carriers that are able to go 6 months. And if I'm doing a direct mail campaign, any type of advertising campaign, I'm going to start ordering that mail 6 months prior.
6 months prior. Yeah,
okay.
Absolutely.
Now,
we do have a couple of questions here.
Okay, let me go one thing. The flip side of that is, obviously not everybody is a Medigap customer.
Right.
So it will require intense follow-up on your end to secure them once they've received their Medicare card, if you are
Well,
going
and also
MAPD
for
with them.
the well, for the drug plan too,
Right.
because you can only do that
Correct.
certain amount of time out. So we do have a couple of questions I wanted to answer. So Vicky said, if someone takes Part B after they turn 65 but remains working and have group coverage until retirement, how does that affect the guaranteed issue or open enrollment? So that takes away the open enrollment from them because it's based off of them turning 65 or Part B effective date. So at that point, they only have a guaranteed issue right, and that would be them coming off of that group coverage. But it gets tricky because the guaranteed issue, you can voluntarily and involuntarily come off of it depending on the state that you live in to get the guaranteed issue right.
However, Vicky, in that case, if the person is healthy, I would still try to go underwritten for
Absolutely.
compensation
Instead of,
purposes,
yeah.
because if open enrollment, underwritten, pay you all a compensation,
Yes.
and a GI guaranteed issue is a fraction of that, and in
Yeah.
most cases, a one-time payment.
Yeah.
Okay, so
Correct.
someone turns 65 while they're working, takes their Part A and B while they're working, maintains group insurance for a few years,
Right.
retires, they absolutely have a guaranteed issue right.
If you need to use it, yeah.
However,
If they can pass
I'll ask
underwriting.
them, hey, do you mind if I ask you some health questions
Right.
to see if we can get you approved underwritten?
And
And I would always try.
it doesn't restrict the plan that they can take out then. Because a
Correct.
lot of times the guaranteed issue with, I mean, it's going to restrict it
Correct.
on the plan that they can get. The other question here is, um, if it's a guaranteed issue, how long do you have to enroll them? Um, so the timeframes on guaranteed issue are different depending on the circumstances. Have to be the company that they are presently with. For example, Humana Medicare Advantage to Medicare Supplement can be put with the guaranteed issue with United Healthcare. Um, so you're saying guaranteed issue, maybe a trial right, or maybe referring to the like the plan ending, because I know a lot of the Medicare Advantage, I think more than ever, ended and are not available in 2025, and those members did have a guaranteed issue right, and there is a time frame for the guaranteed issue right on those. I think it's 3 months. Is it 3 months that they have?
63 days in most
63.
cases. Yeah.
Okay. So there's a time frame there. And then it's different for like a trial right if they're coming off of a Medicare Advantage. They do have to go back to whatever supplement they were with in a trial right. Um, and if it's not there, they do have a guaranteed issue right to go to any carrier. But you have to do it within the 12 months. So there's a 12-month time frame with that one. I
Yeah.
hope.
So I think that I'm having a hard time with the question.
Yeah.
So the guaranteed issue situations we were talking about were essentially retirement,
Hmm.
but there is another guaranteed issue scenario, which would be a trial right,
Right.
where if it was my first time on a Medicare Advantage,
Hmm.
and within 1 year of having that Medicare Advantage, I wanted to go back to a Medicare supplement, I would
Yes.
have that opportunity, guaranteed issue. However, I would have to go back to the same carrier,
Same
same
plan.
plan that I had, if it is still available. If
If not.
not, it does open up that you can go to another carrier. As far as the agent activity, it's going to require some shuffling of
Oh, yeah.
paperwork, and
Absolutely.
it's going to be a little bit lengthy process. I mean, you're going to have proof of the other one discontinuing.
Yes.
Uh,
If they have access to my Medicare, their my Medicare account, that gives them those dates,
yes.
which I have used that as proof for those dates of the Medicare Advantage being in effect and things like that. So that's one of those things where you guys can call us and ask those questions whenever you're have that scenario come up. That's what we're here for.
But I do think that's the only guaranteed issue situation where you would be restricted to a
Hmm.
certain company you have to go
Right.
to. Is there
Yeah.
another one? Aaron might have
Yeah,
one.
it looks like it. So an 80-year-old that just retired in December, going to do an application tomorrow with Allstate. Should check open enrollment instead of guaranteed
If she
issue.
retired and is just now
Right,
getting on Part B,
right.
absolutely open
If
enrollment.
Part B is just now going into effect, you can use open enrollment instead of a guaranteed issue. Now, if she already had Part A and B, then you're going to have to go guaranteed issue with that. And
Unless you'll health qualify, then you could
yeah,
try underwritten, yes.
yeah, absolutely, absolutely. Um, when does the benefit the
It
recipient
benefit.
not to turn their Medicare Part B if they're still working and covered with their?
That depends on the employee coverage.
It
Some of them are
does,
going to require them to get Part B.
right?
In most cases, it, I mean, truth be told, to have Medicare Part A and B and a Medigap is generally better than any group insurance anyway. So if I have
Because it's so
people
expensive.
that are staying at work, um, I'll always do a comparison. What are they taking out of your check every couple weeks? Because a lot of times, even Medicare A and B in a supplement is less than what they're paying for their group insurance,
Mm-hmm.
and it's 10 times better insurance. You don't have the huge deductible, you don't have all
Right.
the copays, you're not restricted to the
Restricted.
networks.
Right. Yeah,
So I would
absolutely.
always kind of do that more often than not. Again, depending on what they're paying. It's hard to get somebody off, no, my company pays for my health insurance,
Right.
no matter
Or
what their
if it's
deductible
covering
is.
just more than them,
Right,
if it
right,
covers, family members as well, that
right.
gets a little tricky too. So she was clarifying the question on that guaranteed issue. So Humana, the plan that they were on, left the market for 2025.
Okay.
No, you
No.
do not have to put them with Humana. They do have a guaranteed issue, right? Because that plan left. They have a guaranteed issue to go to a Medicare supplement, or they can go to another Medicare Advantage with any carrier. You're not restricted on a carrier with that case.
And Connie, you can call us on the side. I believe they actually have till the end of February
They do.
to do that.
They do. Yeah, absolutely.
So,
Um, so we do have Stephen has a question here. Co-insurance would be a greater
correct.
impact, but some employer plans have high deductibles. Yeah,
Yes.
they do. Absolutely.
Yep.
Absolutely. You want to
All
finish
right.
this slide
Yep.
here?
Moving on. And then now I think we're talking about MA in the dark yellow. The IEP initial enrollment period is 7 months, starting 3 months before you turn 65, ending 3 months after you turn 65.
Yeah.
Definitely, that 3 months could turn into 2 months, 2.5 months, 1.5 months, because you do need their Medicare uh, card
Hmm.
prior to enrolling in an MA. So, and typically they'll come out 3 months. They'll receive that 3 months before turning 65.
Right.
And then obviously you have what we currently have right now, OEP, open enrollment period, which runs from January 1st through March 31st. That's a period in which people that currently have MAs can
Can
change
change
MA to
one time.
MA.
There's a one-time change. Yeah.
Correct. And then you have AEP, which is what I consider the wild, wild west.
It is.
They can do whatever they want, get off of an MA on back onto original Medicare, get a supplement. They can come off a supplement, get onto a
Right.
Medicare Advantage to
It's a free
begin
for all.
January 1. And
Yeah.
that's becoming a lot more and more common
Hmm.
as the years go by because of that we've been seeing, the days of
Yeah.
3%, 6% increases on med sup policies on especially an F or a G plan,
Hmm.
those days are over. The majority of the increases now are double-digit increases.
Yeah,
So a
they are.
lot of people are considering getting off of Medigap. And over the years, quite frankly, Medicare Advantage plans have gotten a lot more competitive than when they
Yeah.
first came out. If you talk to any insurance agent that was doing this back in 2010, even,
Hmm.
if they were talking to someone at turning 65, they may not have even been contracted with any MA plans.
Right.
They were just down talking them. You don't want one of these, and that's not the case anymore. So a lot of
No.
people are moving from Medigap to Medicare Advantage strictly based on the monthly premiums and the increases they've been experiencing.
Yeah, and I think that it's important for you to be able to offer either of them. I know I have some agents that only sell Medicare Advantage or only sell Medicare Supplement. I think it's important to be able to offer both because if you're not selling it to them, somebody else will. Yeah, so you want to make sure that you're able to offer, either product to your Medicare members.
And then of course we have the SEPs that depending on the situation, generally run year round. Um, Plan terminates in your area that you're currently on, that would open up an election period for them to get on a new plan. They move out of the service area, that would allow them to get on a new plan. Of course, Amy touched on it a little bit ago. Sometimes there's disasters. Those are really getting out of hand, in my opinion. The joke
They
around the
are.
offices is, hey, I saw a wreck on Central Avenue. We're gonna have an SEP till March, and then that's because seriously, I mean, I think we had a snow SEP here, and I
Oh,
mean, we're in central Arkansas where, I think that year we did get some snow, but still, any little thing,
yeah,
will qualify for an SEP, and again, they're clamping down on that beginning April 1.
right.
So then you
Yeah,
move to Medicare supplement, open enrollment, 6 months prior, 6 months after they turn 65, they can get on a Medicare supplement, no questions asked.
right.
They have a guaranteed issue right, qualifying life event, again, retiring with insurance, group insurance that
Group
was
insurance.
creditable coverage. Another guaranteed issue right for a Medicare supplement is a terminating Medicare Advantage plan.
Right.
If it terminates, they're also guaranteed issue can go to a supplement at that point. And then underwritten any time of year. If any
Yes.
of you have a fairly large book of Medicare supplement business, I can assure you I do, and I've told every one of them as I sold them, as I serviced them, anytime I talk to them, you can change your supplement any time of year as
Anytime.
long as you're healthy. All of them are calling me October 15th
Oh,
saying,
no, it's crazy.
it's this time to change. So
Right.
I just go with it, and I anticipate that my AEP is going to be just as busy on
Yeah,
Medicare supplements as it is Medicare Advantages, because
so true. I
no
guess
matter
they
what.
see the commercials and they just think that. I don't know, but yeah, we do. We get that a lot. Absolutely. All right. All right. So we have the types of Medicare here. There's different parts here. So Part A, that's what your original Medicare. We typically call Part A the hospital coverage. So that is the one that they usually will get automatically when they get turn 65 or get Medicare disability. And then the Part B, well, let me go over what Part A covers, I guess. It does cover the inpatient hospital stays and skilled nursing and hospice, home care, things like that is what your Part A is going to cover, 80%, of course, with a deductible. Your Part B, we call medical coverage. The Part B medical coverage, that's for your doctor's visits, your lab tests, medical equipment, preventative exams, things like that will be covered under your Part B. And the Part B is also the premium that gets taken out of their Social Security check before they receive it. They have to pay for the Part B. The Part A we paid for over the years while we were working. So the Part C, if you hear anyone talking about the Part C, it's the Medicare Advantage. So a Medicare Advantage groups A and B together, and a lot of times D too. So it replaces the Part A and B with that carrier now is the Part C. Now, those will usually have extra benefits that original Medicare would not have included, like the vision, hearing, dental. I mean, you see all these carriers coming out with so many different, perks and benefits on their plans. Eyeglasses, hearing aids, things like that. And a lot of those are going to include the Part D drug coverage. Now, I want to mention this because we've had this happen a few times lately. You can't have a standalone Medicare Advantage and a standalone drug plan if it's a PPO, HMO. Those cannot be standalone. They have to be an MAPD that have all included into one plan. So I just want to mention that real quick. And then your Part D is your prescription drug. So that's the one that's going to be paired mostly with your Medicare supplements or original Medicare, because that does not have any coverage for the drugs with the Medicare supplement or original Medicare. So they will be penalized also if they don't have drug coverage. So you always want to make sure that they get drug coverage so they're not penalized on that. So we have the Part A and Part B overview. You want to go over that one?
Yep. It give you the overview for our knowledge, but again, in explaining this
Mhm.
to clients and trying to simplify the process, obviously, if they have questions that might be answered with some of these things, I'm going to answer those questions for them. But
Right.
again, when I'm trying to secure an application, when I'm trying to give a demonstration on, especially somebody turning 65, I'm generally talking about, number one, hey, most Medicare members have three options. You can choose to go at it with Medicare A and B only if you want. Live the rest of your life just on Medicare A and B, that's fine. I'm going to say, here's the downside to that. Okay. The other option is you can have Medicare A and B, a Medicare supplement. You can have Medicare A and B and or you can have Part C, okay, which is Medicare Advantage plan. Basically, those are your three options. Talking about the
Yep.
good and the bad of each of those three. And one of the more confusing parts is why are there two parts to Medicare A and B? Okay, so I really want to simplify that. And in my discussions, I'm telling them, hey, the easiest way for you to remember this is Part A is the hospital, Part B is the doctors. Okay, so what Part A covers, and again, um, not always necessary to go over this,
No,
okay,
because
in a
it's kind of
presentation.
self-explanatory too. Yeah.
Covers inpatient hospitalization. It does have a benefit period deductible. Okay.
Right.
So especially if I'm aiming for a Medicare supplement, I will stress that. Okay. When I'm explaining Part A, hey, Part A hospitalization, you have a deductible. And what I tell them to simplify it is in a nutshell, Medicare Part A is going to pay 80% of your hospitalization bills after you've met a deductible. However, that deductible goes off of a 60-day benefit period. So, although unlikely and it would be very unfortunate, there is a chance that you have to pay this deductible multiple times over the course of a year.
You can.
Okay.
Yeah.
And then again, once the deductible's met, Medicare is going to pay 80%, you're going to pay 20%. Again, in a sales atmosphere, I'm giving them personal experience. Hey, I remember being hospitalized for 4 days one time. I remember seeing the bill, it was $175,000, and just in their mind, I want them, oh, let's see, 20%. Yeah, okay.
Yeah.
I don't want to go at it just Medicare A and B alone. But also covers skilled nursing after a 3-day hospital stay. Also covers home health, hospice. Again, as with anything that Medicare is going to cover, it has to be doctor ordered or what we would say medically necessary. Okay, it is funded by the taxes. Most beneficiaries pay no premium if they work 40 plus quarters. Okay, again, Part B. I can go over this demonstration, or I can say I can make it simple for them. Part B covers your doctors. You go to primary care, you're going to have a deductible. Fortunately, this deductible is annually. So once you've met that, it does run January 1 through December 31. Once you've met that annual deductible, Medicare is going to cover 80%. You're going to be responsible for the other 20%. It covers doctor visits, outpatient procedures, lab tests, durable medical equipment. Again, it does have an annual deductible. Medicare pays 20, you pay 20%. And then obviously we have charts available. Part B premiums will go up at different levels of income.
Yeah, they do. Absolutely. And majority of them are paying the 185 is what it went to for 2025 for the Part B premium. And the deductibles also both increased for 2025 as well. All right, so this is Medicare exclusion. So this is just going to kind of go over the things that Medicare does not cover. And you want to get these ancillary products for this stuff.
Yeah, and we're looking at running 15 minutes, and I think we have several more slides.
I think so.
Try and speed things up here.
Yeah.
Medicare exclusions. Okay, Medigap. Again, for that 20% for all deductibles other than the Part B deductible,
Right.
you can get a Plan G Medigap plan that will cover everything except the Part B deductible.
Yep.
However, if they turn 65 prior to January 1 of 2020, they are also eligible for an F.
Yes.
Which will pay that Part B deductible.
Right.
Okay.
Right.
What isn't covered in Part A and B? Medicare doesn't cover everything.
Right.
Medicaid may cover it. Medicare Advantage plan may cover some of the things that Medicare does not. For example, dental,
Vision,
vision,
hearing.
hearing.
Yeah.
Otherwise, if you're in Medigap, you're looking at a standalone plan that may
Right.
cover a portion of those.
Yeah, absolutely.
So briefly I did that one very briefly. So we
Okay.
can
Okay.
move
Yeah.
on unless you
So,
saw something real important
well,
on
I mean,
there.
long-term
But
care has been a big issue here lately, with, them needing coverage for that, and Medicare doesn't cover it. So, if they can afford the, long-term care, it's very, very important. We have had that come up here recently because it's expensive to go into a long-term care facility.
yeah, and
Yeah.
generally people that are looking for a long-term care policy, it's to protect assets.
Hmm.
And generally the assets are large enough that the people could afford
Can.
them, but
Yeah.
they are very expensive. I had my father-in-law actually cancel one that he had for years, but his had gotten up to $850 a month.
Right.
And,
Wow.
in a lot of cases,
I mean, that's
I
about what
think
you would pay for the
I
long-term care.
I think he said when he got it, it was maybe 150, and it just kept going up and up and up, and
Wow.
but yeah,
Yeah.
long-term care would be included in those things not covered by Medicare for sure.
Yes. Yeah, absolutely. Now we have this is just kind of a comparison of the Medicare supplement versus the Medicare Advantage. Um, on the Medicare supplement plans, as long as they accept Medicare, they're going to take the supplement. And the supplement is, required to pick up behind it, of course, according to the plan you have. But if Medicare pays, the supplement pays, and it does exactly what the name of it is. It supplements the Medicare. Now, the Medicare Advantage plans, you are usually restricted on the doctor, and that you can go to. Now, of course, a PPO is going to give you more freedom than an HMO will, but they do usually have some type of network where they have to see a certain doctors and hospitals to get coverage, or they pay a higher cost. Now, on a Medicare supplement plan, you don't have to have a referral to see the specialist. Typically, you will with the Medicare Advantage. Now, the PPOs don't always require them to have a referral, but the HMO will for sure. Um, enrolling, we already went over that. You can get a Medicare supplement at any time as long as you can pass underwriting, or during your, open enrollment or your guaranteed issue rights. The Medicare Advantage, they are restricted when they can get in and out of those plans. They're locked in for the year usually. Um, so you want to make sure that you make sure their medicine is covered, their doctors are in network, that all of that. And we have great, great quoting tools to be able to put that all in there and find out what plan is going to cover those things. Um, the cost. So, I kind of look at it this way: on a Medicare supplement, you kind of know what your, cost is, not the increases each year, but you have a monthly premium, you pay that, you have coverage if you go to the doctor. The Medicare Advantage, you may not pay anything monthly for it. Your cost comes at the time of service. So that's the big difference between those two. Is generally the cost is at the time of service with the Medicare Advantage versus the Medicare supplement. And majority of the Medicare Advantage plans do include drug coverage. And if they need drug coverage, make sure you get a Medicare Advantage that includes that. You do have to have the standalone drug plan paired with your Medicare supplement insurance. So make sure that you guys are looking at that as well. And they'll be penalized, as I said earlier, if they don't have drug coverage, if they go without it.
And that last slide, if you all do get these slides and this
Yes.
one are very good presentation
For the client.
materials for
Yes, for
you to have in
clients.
front of them, especially
Hmm.
if you're leaning towards supplement, because I mean, truth be told, if you've been in this business any amount of time and have 100 clients, let's say, you can generally tell you should be able to generally tell what's going to be best for the client, whether it be a
Yes.
supplement or a Medicare Advantage. And if you know this client is more of a supplement candidate, that last slide is real valuable in, hey, here's the benefits of a
Right.
supplement, here's the downside to a Medicare Advantage. Where And again, in my presentations, I'm telling them the three ways. It's first Medicare A and B alone. And my hope is that as I'm explaining the Medicare supplement, um, they stop me right there, and it's, hey, no, 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 this is the one I want. And I'm okay, now I'm gonna obviously touch on MA. I say, hey,
Right.
even though you want the supplement, I also want you to know about the Medicare Advantage plans as
Yeah.
well, because the last thing I want them to do is go with someone else on a plan that I could have written
Right.
them.
Because you
Okay.
just didn't go over
So they need to
it.
know that I'm able to do all of them.
Right.
And again, I don't want them to be misled, because I personally have clients that have left my supplement and then they're calling me, Robert, I talked to somebody. They said it was the exact same policy as this mine, but I didn't have to pay for it. Okay, so there are bad actors out there.
Oh, yeah,
Okay,
for sure.
as you see things getting a
Hmm.
little bit more challenging for us year to year due to CMS regulations,
Yeah.
call recordings, 48-hour scopes. These things aren't done because of great insurance agents. These things are put in place because there's bad actors out there making it a little bit more challenging for us in order to protect the Medicare members. Okay, so I want my clients to know that I can do everything. The best question they can ask me at the end of a presentation, well, Robert, what do you think I should do? I'm gonna trust you.
Hmm.
Oh, perfect.
Yeah.
I think you're going to, due to your limited income, I
Right.
think this Medicare Advantage might be a
A
better for
better
you.
fit. Yeah.
Or due to your current health conditions, as you're turning 65, it looks like you're going to be in and out of doctors, specialists, hospital stays. I think, that because your budget will allow, I think we need to go the Medicare supplement route. Okay. But that comparison, and then these two right here, this slide right here, also very valuable tool
It is.
when making a presentation and you're not sure which way you're going to go, when we put it that way. I know
Yeah.
a lot of our clients that we're going to see, a lot of our potential clients, they already have a Medicare Advantage. They're happy with Medicare Advantage. You're
Right.
just moving their Medicare Advantage plan. I
That's true.
know a lot of them have a supplement, will never leave a supplement,
Right.
so you're just getting them a better price. But at
Yes.
turning 65, they do have several different options, and those are two valuable tools that you can use during your presentation.
Yeah, absolutely. I would agree. All right, so we have next here is the Plan N. I think you are the one that loves the Plan N.
Interesting
I've
slide.
been explaining the Plan N a lot lately, as far as the increase on the Plan N is typically a lot less than it is on the G and the F. So that is kind of a selling point, I think, on the Plan N. And it really, honestly, it's very comparable to the G, except for a $20 copay and the $50 copay. I think that it's a
Yeah,
great option.
as far as supplement business goes, I like the Plan N because, I mean, what could you imagine if you were going shopping for cars and they were half price? The salesmen are going to love to sell you. If their sales manager says, "Hey, you can go," they want that car, but it's too much. Go give it to them half price. And not saying that a Plan N is half price, but it is the
A
lowest.
lot
In a
less.
lot of cases,
Mhm.
less than $100 a month.
It is
Okay,
usually.
so now all of a sudden, for people on a fixed income, and look, we deal with them from ranging from 600 to 2,400. The majority of my clients, in fact, are on Social Security income only.
Right.
Okay, so a big difference
It
between
is.
100 or $88 versus 150, 180, sometimes 200. Okay, the carrier also offers a little bit higher percentage on the commission, to maybe offset that low premium that your commission would be on. Um, if it's somebody retiring from a job, it is very similar uh, to what they've had at their job, in a sense that it does have copays. Okay, again, some of the benefits of a Plan N: lower price, easier to sell. Okay, much easier to sell somebody a supplement at $88 a month versus $188 a month. Okay, and again, I don't know what areas you're in. It might be
Right.
115, but I have seen them in areas as low as $88 a month, $80 a month. So in the event, use the Plan N, a copay. It says after the Part D B deductible is met, the copay is up to $20. Okay. I tell my clients, hey, I say up to $20 because I have some clients that have this plan in that don't even pay a copay
Yeah,
at the
a lot
doctor.
of times they
Some
don't.
of it's 5, some of it's 10,
Mm-hmm.
but this plan will protect you
Right.
to where it won't be over a $20 copay. So if you just want to go into it thinking there's a $20 copay every time, fantastic. But there's a chance there won't be
There
a
won't be.
copay at the
Yeah, a lot of
doctor,
times if
okay?
they see they have a supplement, they don't even charge them the copay.
No,
Yeah.
yeah, a $50 copay at the emergency room visit, it's waived if you get admitted. You
Right.
go in there because you think your thumb is falling off to the emergency room, and oh, hey, it's just a hangnail, and they bandage you up and release you. You've got a $50 copay.
Right.
You go in there, you think your thumb's falling off, and it's falling off, and they admit you, the copay is
Don't
waived.
have a copay.
Okay.
Right.
The reason these are able to stay at a lower rate, have lower increases is because most of you probably know insurance rates are based on a claim to loss ratio.
It is.
Okay. The reason they don't have a plan F anymore was because they felt if the client had some out of pocket
Cost share
expenses, they
there.
wouldn't go as much. And lo and behold, it worked. A plan in, if they've got the copays, if they knew they had a $50 copay, they're not going to all of a sudden their thumb's not falling off.
Right.
They've just got a hangnail, they're putting a band-aid on it at home.
Yeah.
Okay,
Very
so
true.
the plan ends aren't getting used as much because of the out-of-pocket costs for enrollees. So these typically do have the lower increases, 3-5%,
Usually.
not the double-digit increases that the G and Fs are seeing. Now, one thing that always comes up, and I have to hit on it, Plan
Yes.
N does not cover Part B excess charges.
Very far and few between does that happen.
I've never even seen it. And I have I have
Yeah.
possibly 100 Plan Ns out there.
Right.
Never heard of it. Never heard another agent talking about it. Maybe you all have, but you can
Yeah.
actually Google how frequently are there excess charges, and the percentage is
Well, it
phenomenal.
says here, yeah.
And then even the excess charges is capped. Okay, so
It
it's
is.
not some exorbitant amount that
No.
people aren't going to be able to afford. But I
Right.
definitely would
You
talk
definitely
about
mention
it
it. Absolutely.
because again,
It can.
another agent comes behind you. Why are you on that end? It's not paying Part B
Right.
excess charges.
They didn't tell me
You
that.
need on this G. What you could be, who knows what another agent is going to tell them.
Right.
So make them
Aware.
aware of it.
Yeah. I mean, usually if the doctor accepts assignment, they're not going to charge more than what Medicare has approved for that particular procedure or whatnot. Generally, it doesn't happen. From my understanding, it used to back in the day a lot, but it doesn't usually.
It's not
very
worth it for the
seldom.
doctors to have to chase money anymore. So they're
No.
just willing to take what they can get
Yeah.
and go on. So
Right, right. All right. So next we have the resources to prepare. So I have this at my desk, and it is the Choosing of a Medigap book at all times. I carry it with me just in case. So that's a good tool and resource to have, not only for yourself, but for the clients as well, that take the Medicare supplement. The Medicare and You handbook is a great tool also. And then all of these will be and sent to you guys. So just so you know, it'll be a PDF document sent to you guys with this stuff. You have the Social Security Administration cheat sheet that he has here. Yeah. And it kind of goes over different things. I think it goes over
Part B
like the
premiums.
IRMA, I think, if they have to pay more for their Part B premium and things like that.
Has the deductibles, the premiums, what their premiums are if they
Yeah.
have a higher income.
Yeah, it's a good tool to have as well. The marketing best practices. So the open enrollment period, which we did go over those rules earlier on what they can and can't do during OEP, but the marketing best practices is right here. Let me see this one. Oh yeah, okay. This goes over the enrollment periods on all of those enrollment periods. And then we have the industry acronyms. And that's also something that's good to have if you are new to the business and you don't know all the lingo and acronyms. That will be a good tool as well. And I'm kind of going quickly here because I know we're kind of pressed for time. We only got a couple more slides though to go. So just
Did
bear
good.
with us, guys. The collaborate. I'll let you go over that because you're more on the salesperson. I'm more on the back office type thing. So he can kind of go on the collaboration where, you know, you agents can, we did that during our conference where they did the collaboration where you kind of learn from each other and go over your experiences and your solutions. I mean, like he said, we get to share kind of all walks of life because I'm able to tell you what another agent, you know, what works for them and what didn't work for them. And so is he, you know, so we can kind of guide you guys according to what's working and not working for anyone else as well.
Yeah, and look, I mean, call us with your questions. I mean, because
Yeah,
a
that's
lot
what
of
we're
them
here
are
for.
new to us, you know, so now
Mhm.
all of a sudden we're able to solve and answer your question.
Yeah.
It may come up months down the
Oh,
road and
yeah, it will. Yeah.
you know what, Vicky had that, you know, remember Vicky, she had that one deal.
Yeah.
Hey Vicky,
Mm-hmm.
you remember telling me what we did on that one? And we all help each other. You know,
Right.
our the CEO of our company likes to say a rising tide raises all boats.
Yeah.
And we are here to, whether you're with us, whether you're not with us, we are an open book and just want everybody to, number one, succeed in their trade, and most importantly, really genuinely take care of Medicare members out
Yes,
there. Okay, if
absolutely.
Medicare members are being taken care of by agents, again, whether they're with us or not with us, it helps us all out as a whole.
Yeah,
So
absolutely.
always willing to help whoever it may be.
Right. Yeah, absolutely. That's what we're here for. So we have, I mean, if you have questions, we have the Facebook page. We have you know, you can always call us, email, which I do believe we have here on this next slide. So you can always use this email address, this phone number to reach out to us with any questions or concerns. You know, now I do want to mention we have the survey at the end of this. If you guys will please, you know, take that survey so we can, you know, kind of get some feedback on that. We also have part 2 and part 3 coming. So those will be next week and then the following week. Next week, you're going to have Jennifer and Melanie. They'll be going over the product knowledge and kind of what you guys need in your briefcase, you know. And then we have Sarah and Adrian on the part 3, and they're going to go over how to market yourself and promote yourself and advertise and things like that. So we still have 2 more parts of this that are going to be just as valuable as today. So be sure that you continue to join us for the other 2 parts. Do you have anything else?
No, I really thank you guys for being on here. I hope
Yes.
some of you could take some of the things we talked about. More importantly, if
Yeah.
there's any follow-up questions or anything you need, just call our office, ask for Amy or Robert. We'll be happy
Yeah.
to help.
Yeah. And I think your email is at Robert at
Robert at
and mine's
eisgroup.net.
just Amy. They kept it simple for us, so we're good there. All right, you guys, thank you so much for joining us today, and we hope to hear from you guys soon. Thanks.
Happy selling.